Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. And today, Judy Darcy made a statement that the province of British Columbia is opening 123 new beds for youth with substance abuse issues. And this is in an effort to make strides towards helping not only eliminate addiction, but also helping people with mental health actually get the treatment that they need so that they can cope with their illnesses and traumas that are bringing them to doctors and into treatment centers. So this is going to be a good step towards really helping people that have mental health and addiction issues. So let's listen to Judy Darcy, and she has a member from a home joining her, and he's also going to make a few statements also and answer some questions. So let's listen and hear what they have to say.
Thank you very much. I'm Judy Darcy, the Minister of Mental Health and Addictions for British Columbia, and I'd like to begin by acknowledging that we're gathered here on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nations, but I'd also like to acknowledge that all of you out there are gathering on traditional territories of Indigenous people right across British Columbia, and I'd like to express our gratitude for all Indigenous peoples for the opportunity to gather on their lands. We are living in an unprecedented time, a global pandemic and a fentanyl poisoning crisis that is taking a significant toll in urban and rural and remote communities in British Columbia and right across Canada. Last month, a staggering 175 people lost their lives due to fentanyl poisoning of drugs on the street. They are our aunties, our uncles, our cousins, our sisters and brothers, our children, and our dear friends. Some were young people with bright futures ahead of them that were snatched away because of fentanyl poisoning of the drug supply on the streets. I have sat with parents who have lost children in this overdose crisis. I have heard the heartbreak and the anguish in their voices and the pain that they will live with for the rest of their lives. I've also heard about how they knocked on one door after another, trying to get the help and the support that their child needed. And now we have one public health emergency on top of another. And that is taking an enormous toll on young people and on their families across BC. For too long in this province, youth who were struggling with addictions had to face long wait times for care. And the options for substance use treatment and care were also very limited. That's why building more healing spaces, building more ways, more access points for youth to get the help that they need to cope with addictions is more important now than it ever has been before. Between January and June of this year, 60 young people under the age of 24 lost their lives in this fentanyl poisoning crisis. 60 sons and daughters whose lives were cut short because of a poisoned, illicit drug supply. Last week, we announced the opening of Traverse, a new 20-bed youth treatment center in Chilliwack. Before that, there were only 104 youth treatment beds in all of BC. A combination of withdrawal beds, residential recovery beds, and highly specialized youth treatment beds, 104. In fact, Under the previous government, the number of youth treatment beds actually went down by 25% at a time when overdose deaths were going up. Today, I am thrilled to announce that our government is more than doubling the number of youth treatment beds to young people struggling with addiction right across British Columbia. We are committing $36 million over 2.5 years to fund 123 new addiction treatment beds for youth and young adults aged 12 to 24. These beds will include withdrawal management and detox spaces where youth can get the medical attention that they need to manage withdrawal and to begin their healing journey. They will include residential recovery beds that will offer a much-needed safe haven from challenging and high-risk living situations for youth, and it will include highly specialized treatment spaces which can include 24-hour psychiatric nursing care and support. But whatever the option is, it will be safe, it will be linked to a continuum of care, and it will be connected to culture and to community. There is nothing more pressing than every young person in this province getting the supports that they need, not just to survive, but to thrive. And today, we are taking a historic step forward to making that a reality for youth struggling with addiction across BC. With these 123 new beds announcing today and the 20 new youth beds announced in Chilliwack last week, we are adding a total of 143 youth treatment beds, the largest investment in youth addiction treatment in this province ever. We are working with health authorities and with the First Nations Health Authority to ensure that those beds will be placed in communities where the need is greatest right across the province. We know that there are critical gaps in services for youth, and we know that health authorities will be working with us around the clock to expand existing facilities and to create new spaces so that these beds can be available quickly because they're needed quickly. Providing the right substance use services at the right time and close to home is absolutely critical. Just over a year ago, Premier John Horgan and I launched a Pathway to Hope, a 10-year plan for better mental health and addictions care in British Columbia. And our primary focus is on going upstream. Our primary focus is on prevention. It's on improving mental health and wellness for children, for youth, and for young adults. Because we know that addressing small issues before they become big ones can have an enormous impact on young people, on their families, and on entire communities. That's why we've also committed to expanding our one-stop shop Foundry Youth Centres to 19 Foundry Centres in urban and rural British Columbia. That's why we've built mental health supports into our school systems to help more kids open up who may be struggling with mental health issues, and for them to learn at an early age, it's okay to say, I'm not okay. That's why we're also creating robust child and youth mental health teams in school districts, starting with 5 that we've announced so far. Our government's vision for mental health and addictions care is clear. We need to support youth early on, and we have to provide high-quality substance use services and care wherever they are in their healing journey. And so today's announcement is a historic step forward in our work to build a system of care that works for everyone. There's still much more to do, but we're not going to take our foot off the gas until every youth, everywhere in British Columbia, is able to get the help they need when they need it. Together, we can turn the tide on this terrible crisis. Let's continue to look out for one another. Let's continue to take care of one another. And let's continue to come together as a province to save lives. I would now like to take the opportunity to introduce Colin Tessier, who is the Executive Director of Threshold Housing Society, an organization that's been providing housing and support for at-risk youth in Greater Victoria for the past 30 years. And in September, just next month, they will be celebrating their 30th anniversary. So great to have you here, Colin. Their experience gives them a unique and a deep understanding of the need for these treatment beds and the impact that this investment will make for youth of this province for years to come. Please welcome Colin Tessier.
Well, thank you, Minister Darcy, and to everybody who was involved with this announcement today. It is truly an exciting investment in youth in our community and one that is desperately needed. As the leader of a community-based nonprofit that supports at-risk youth, I can attest to the devastating impact that substance abuse and addiction have on young people in our communities. At Threshold Housing Society, we provide safe housing, support services, and healthy community to youth who are exiting homelessness, who are aging out of the child welfare system without adequate support, or fleeing violence or abuse in their home. These young people are an incredibly vulnerable group, and invariably have experiences of trauma that undergird and exacerbate challenges in their lives. Substance use and mental health challenges are a reality for more than 80% of the young people that we work with at Threshold, often co-occurring and intertwined. Without appropriate supports, the outcomes are predictable. They include further trauma, harm, and even death, as the minister just pointed out. We are in a crisis today with the poisoning of the drug supply. We're losing far too many people and far too many youth, and we need action and investment to curb that tide. And there is hope. There is hope in investing in young people and in youth. By directing resources to youth in our community, it provides an opportunity to change the life trajectory of someone who is looking down a very dark path. The level of entrenchment for youth is often less than in adults, and targeted supports and interventions at a young age can have a tremendous and long-lasting impact. Investing in youth-specific treatment facilities helps to fill a significant gap in the continuum of care and will allow young people better access and help when they need it the most.
It's 13 hours.
When a youth makes a decision that they would like to pursue treatment options, those resources need to be readily accessible and provide a diversity of options to consider. That window of clarity and the desire to seek help can shut so quickly, which is why this investment today is such welcome news. We're healthier as a community when we take care of our young people, and indeed we have an obligation to do so. And in doing so, we help to create a better future for all of us. So just want to thank again the minister and for this investment. It's welcome news. It's desperately needed today. At Threshold, we have a lot of young people who are going to benefit from these beds, and I know that's true throughout the province. So thank you very much, and I look forward to working with everyone moving forward.
Good. Okay, we're going to move into the question phase of the announcement. First, I would like to remind everybody to please press star 1 to enter the queue. You are limited to one question and one follow-up only. Please take your phones off mute. You will not be audible until I call your name. First question is from Richard Zussman, Global News.
Minister, can you explain to me why the priority are youth treatment beds, considering a majority of those dying of illicit drug overdoses are not youth?
Well, we have also made some significant announcements recently about adult beds. We have just opened the Royal Columbian Hospital Mental Health and Substance Use Wellness Center that will add 45 new beds, adult beds. We made a significant investment in opening Our Place Therapeutic Recovery Community here in the Victoria area, which is 40 new beds, and there are a number of others for a total of about 150. But we also know that it's absolutely critical that we start early with our youth. And as Colin explained very eloquently, youth are less entrenched in their addiction at a younger age. And the earlier that we can support people, the more we can prevent them falling into a lifetime of addiction.
Do you have a follow-up, Richard?
How many more beds are needed to meet the demand? Is there a sense, Minister, right now what the demand is for these beds for youth?
Well, beds are one piece on a continuum of care, and some people are ready to go into a treatment bed, others are not. And what all of the medical experts, what all of the addiction experts tell us, and what our experience tells us, is that we need to be able to meet people where they're at and give them the supports they're at wherever they are on their journey. So that means we need to be able to provide harm reduction services. It means we need to be able to provide medication-assisted treatment, a safe supply of prescription alternatives to separate people from the poison drug supply. We need detox, we need supportive recovery beds, and we need more intensive treatment beds, as we've announced today. And we also need things like addiction counseling, and we've done a massive expansion of access to affordable or no-cost mental health and addiction counseling. So it is estimated that there are over 60,000 people in British Columbia today who have been diagnosed with an opioid disorder, an opioid use disorder. And there are many, and it's estimated there could be twice as many as that who actually are living with an opioid use disorder. But many of those people are not diagnosed. Many of those people are not ready to go into treatment. We have approximately 3,000 beds in the province at this time, and we are continually doing a careful assessment about what we need to do to keep building that continuum of care, because beds are one piece of it, an important piece, but there are many other pieces as well.
Next question is from Lisa Cordasco, CHLY.
Good morning, Minister. Thank you for taking my question. I'm wondering, when will the sites or places announced today be operational, and can you put into context how much will this reduce wait times, especially for residential treatment for youth?
Well, right now we have 104 treatment beds in the province, and we've announced between last week's announcement of the new Chilliwack Youth Treatment Facility with 20 beds and the announcement today of 123, that's 143 new beds. So we are more than doubling, biggest investment ever. We think it will make a significant difference in reducing wait lists, and health authorities are moving at breakneck speed in order to get these new beds out the door. So there will certainly be a significant number of those beds that stand up during this fiscal year. This commitment is over the next 2.5 years.
Do you have a follow-up, Lisa?
Yes, this is for Mr. Tessier. I'm wondering, in your opinion, where is the weakest link in addiction treatment for youth, and how might this announcement address
it? From my perspective, it's actually quite hard to tell where the weakest link is. There's need throughout the continuum of care, and it's important to invest in a variety of parallel programs and projects in order to really fill that gap. Because if there's one gap in that continuum, then people are falling off. And so certainly addictions treatment beds for youth is a significant gap today. There's a long wait list to get a young person into a treatment bed. And often you'll miss the window of getting that person the support they need in that moment. And so this is an example of filling a really critical need in the system. But as Minister Darcy just mentioned, there are numerous others: harm reduction support, addictions counseling. All of them work together to support the life of somebody who's battling with an addiction.
Next question is from Moira Witten, Hatai.
Hi, good afternoon, Minister. Thank you for taking the time today. My question is about, you mentioned the continuum of care. Are any youth eligible for the safe supply programs that your government is expanding? If they are, how many? And if they aren't, why not?
There are guidelines in British Columbia that are developed by addiction experts for the use of what's called opioid agonist therapy. That's things like Suboxone and methadone. There's guidance for adults. There's guidance for youth. These are decisions that are made between doctors and their patients. These are not things that are decided by politicians or government policymakers. These are medical decisions between a doctor and a patient.
Do you have a follow-up, Moira?
I do, thanks. There's also been concern about countering bias against particularly Indigenous patients and Indigenous youth in treatment subsequent to an overdose against their will. And I'm wondering how you might begin to address this as Bill 22 consultation, I think, is revisited.
I'm sorry, I'm not understanding the question.
Sure, let me repeat. There is a lot of concern around bias against Indigenous youth in Bill 22 as it was introduced previously. And now that you're revisiting those amendments, I'm wondering how you might begin to counter potential bias against Indigenous youth seeking addiction support in the system overall and in the amendments to the Mental Health Act.
Okay, thank you for the question. Well, from day one and since our ministry was created, we've been working in very, very close partnership with First Nations Health Authority and the First Nations Health Council. And all of the work that we do is in partnership, and these new beds, as well as all of the other work that we do around mental health and addictions, we work to ensure that there is cultural safety and humility that is built into all of those programs and services. When we announced access to counseling services, a huge investment in access to counseling, which in the past has depended very much on the size of your bank account, we ensured that a third of those counseling agencies that received funding were Indigenous agencies. We have also made the most significant investments that our ministry has made, period, in partnership with First Nations Health Authority. So new treatment facilities. We will soon be formally announcing with First Nations Health Authority 6 renovated and rebuilt rural Indigenous treatment centres, that which will be for people of all ages, Indigenous people of all ages, as well as 2 new urban Indigenous treatment centres. We've also invested $23 million in programs that are led and implemented driven by Indigenous people in their communities, $23 million in land-based healing, and another $30 million for programs designed and delivered again by First Nations people in their communities. So we recognize that that First Nations need to be in the driver's seat in developing programs that are appropriate and safe for them.
Next question is from Rob Shaw, Vancouver Sun.
Hi, Minister. The overdose crisis has been going on for more than 4 years. You've been in your ministry for more than 3 years. You mentioned that nothing is more critical than an investment like this, and for far too long, kids have waited for beds. So I'm just wondering, did you just recently realize that this was going on, or did you not have the money, or why 3 years into your mandate are you making this investment when it sounds like you're telling us how critical it is to have done earlier?
Well, Rob, as you know, my mandate is twofold as a minister. It was to lead the government's response to the overdose crisis and to build a better system for mental health and addictions care. And I think that we all recognize that it was a system of care that you could barely call a system of care. It had been underfunded and under-resourced with enormous gaps and total fragmentation for many, many years. So understandably, the first steps that we took as a minister were to save lives and to prevent to do everything we could to save lives and to prevent overdoses. And I think we need to be clear about when this crisis really began, because it's back in 2012 that the numbers began to go up in British Columbia, and they climbed steadily from 2012, 13, 14, 15, 16, which was the year that there was a reduction of beds under the previous government, of youth beds. We were elected in July of 2017. The overdose death toll in 2018 was stable, and then in 2019, for the very first time since this crisis began, it started to go down by 36%. And the BC Centre for Disease Control has been very clear that 6,000 deaths were averted because of the actions that our government took. The coroner has been crystal clear that the number one reason the death toll is going up is COVID-19. Dr. Bonnie Henry has been clear that the actions we were taking as a government were beginning to make a difference. We were headed in the right direction, and COVID-19 hit. And it's not just in British Columbia that we are seeing a spike in overdose deaths. Across Canada, we are seeing the same thing. Now, we have robust reporting here and real-time data, monthly accurate reports. Other provinces do not. But Toronto saw an 85% spike already over last year. Montreal, the highest one-month death toll since 2014. And Alberta, which is notoriously slow to release numbers, had a huge spike as well starting in March. So this is happening across the country. We have responded exceedingly quickly to that, exceedingly quickly by standing up, and the first jurisdiction in North America to do so, access to safe supply as an alternative to the poison drug supply, as well as a number of other measures that we have announced since then.
Do you have a follow-up, Rob?
No, I'm good. Thank you.
Thank you. Next question is from Lisa Euston, News 1130.
Hi, Minister. I'm wondering how this helps in the immediate.
And if you can just reiterate again just how long it will take for these 123 beds to be operational, because you're mentioning the 60 youth that have died so far this year. Is there nothing more immediate than building beds that will come in the future?
Well, they are moving quickly. They are moving as we speak. We're doing this in very close association with all the regional health authorities and the First Nations Health Authority. So the beds they're going to be going to be able to stand up more quickly are probably with existing providers that already have spaces. But they will also be looking at new providers, and there will be an opportunity for providers of substance use care right across the province to put in proposals. So we're moving very quickly, and some of those beds will be stood up within a matter of months.
Lisa, do you have a follow-up?
Just if I can get a bit more details, like if you could just break down a little bit, like in a few months there'll be how many number of beds, and another 6 months how many numbers of beds?
I can get back. I can get back with you with the detailed numbers on that.
Thank you. Next question is.
Thank you very much.
Next question is from Katie DeRosa, Times Colonist.
Hi, Minister. Thank you very much. And I just wanted to sort of follow up on overall the focus on addiction treatment and withdrawal management. For example, at Royal Jubilee, Eric Martin's Pavilion, there's only 21 withdrawal management or detox beds. And I've been told that's been the same number for so many years. So why are those detox beds? Why can't we add more community detox beds or other treatment beds quicker in the community?
Well, that's exactly what we're working with the health authorities to do, and they are doing the really hard assessment and the very rapid assessment of where we need more beds and what types of beds we need in what communities. There are parts of the province that have virtually no detox beds. There are parts of the province that have some specialized beds, but not the supportive recovery beds. So we're looking at what the mix is, what exists already, and what are the areas of greatest need, and where do we need to act most quickly. But most importantly, where can we stand up new beds most quickly?
Katie, do you have a follow-up question?
And as a follow-up, in terms of the agencies, like, for example, an agency like Threshold, are there any groups, nonprofits that you know for a fact will be getting some of those beds?
I can't speak to which agencies where or which facilities will receive the beds. That's not a decision that the minister makes.
Thank you. Next question is from Jeremy Hainsworth, Glacier Media.
Hi, Minister. Thanks for doing this today. It's good news. I'm wondering if you could perhaps clarify something for me. We hear the term addiction used synonymously with opioid use. And I'm wondering what constitutes addiction, and if use of one single family of narcotics is going to be used as an entry point for people into the treatment system. Who's eligible for treatment? Drugs. What's addiction?
No, thank you so much for that question. And when I mentioned the number of people with opioid use disorder, it was by way of example. It's not to say that only people who are addicted to opioids are eligible. We're talking about people who are addicted to a variety of different substances, various drugs, as well as alcohol. And we have worked very closely with our partners, with addiction experts, with the BC Centre on Substance Use, to develop guidelines very recently, for instance, last year on alcohol use disorder guidelines and guidelines for treatment of people of all ages, including youth, who are struggling with alcohol use disorder. So it is a variety, a wide breadth of addictions.
Do you have a follow-up,
Thank
Jeremy?
you, Minister. No, I'm good. Thank you.
Thank you. Last question today is from Sarah Xenos from CBC Radio Canada.
Hi, my question is actually for Mr. Tessier. So I was wondering how bad is the situation right now in Victoria? And I don't know if you speak French. You do have a French name, but if you can provide an answer in French, it would be awesome.
Oh, pas français très bien, mais moi-même.
I'm sorry, I do not speak French, which is often a question with my last name. Just to speak to the need in our community, it's quite dire, quite literally. And so, as an example, our organization, Threshold Housing Society, has spots for 37 youth at a time. And a recent point-in-time count has the numbers far greater than that. We know that at-risk youth are both known homeless and hidden homeless. We know that they suffer from high degree of substance use and addiction challenges, and so we really need to catch up. This investment takes us quite far in terms of reducing some of those wait lists, I think, for treatment specifically. But it really is a continued investment broadly in housing, supported recovery beds, harm reduction services, addictions counseling long-term. The need is great across the board. And so it's lovely when we can see progress, and we need to keep our foot on the pedal to keep pushing to meet this need that is life and death.
Do you have a follow-up, Sarah? Okay, I'm going to say no, but I know the minister has some closing remarks she would like to make.
Thank you very much, and thank you, everybody, for your interest today. This is indeed a historic announcement where we are more than doubling the number of youth treatment beds in British Columbia, the single biggest investment ever in British Columbia in youth treatment beds. I want to just come back to some of the issues that we touched on earlier, which is that this really is part of building that continuum of care for people of all ages. And we have a major focus on youth because we know we need to start early and tackle small problems before they become big ones. That's why another critical piece of building our continuum of care is the massive investment we've made in Foundry Youth Centres across British Columbia. There was an investment previously of $3 million. We're now spending over $15 million a year in Foundry Youth Centres, and that's a one-stop shop where youth can go in, whether they're dealing with mental health issues, addiction issues, struggling to hold a job, whatever it is, they can walk in the door, they can be surrounded with the care that they need. And these programs and services really work together. And Colin emphasized that. It's not one or the other. We need to build that entire continuum of care from walking in the door at Foundry to youth treatment beds to everything in between, including the investments we're making in our school districts around child and youth mental health. Thank you very much, everybody, for coming out today.
Thank you.
So hopefully if things like this are going to help us deal with addictions and mental health in a more non-judgmental way. Thank you for listening. Hey, did you find that subscribe button? Please do click it so you can receive continuous updates from us here at Depictions Media. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.